Oh. Are we doing this? Okay. I guess we're doing this. All right. Welcome back. COVID-19 is a serious health condition that has impacted people in many ways. Medically, psychologically, socially, economically, and emotionally. For the purposes of today's discussion, we are going to be looking at middle-aged adults who are active and have very few risk factors, which is basically our population here at SOCCENT. On today's episode of Coach's Corner, I want to discuss ideas for returning to exercise in the post-COVID-19 era. What I want to do is categorize our discussion into three separate groups. So the first one is going to be those that have had COVID-19 and were symptomatic, so either hospitalized or told to self-isolate. The second group is going to be those who that had COVID but were asymptomatic. And then the third group is those people that have never had COVID but took time off from the gym for many different reasons. Either they self-imposed themselves to isolate, or they didn't have access to the facilities due to the facilities being closed during this time, and they're untrained, or their muscles and cardiovascular system is detrained now from that. And the reason why it's important is because it's been shown in the literature that exercise is a modifiable risk factor for serious illness following infection from COVID-19. So it should be important to get back into a routine whether or not you've actually had the virus. So let's jump into it. For the first group would be symptomatic COVID-19, starting off with those that were hospitalized. The consensus in the literature is that regardless of your current recovery, prior to doing strenuous exercise, you should get a workup done by either a cardiologist or a pulmonologist. What that workup entails depends on the individual and is outside my scope of practice to determine. But one of the big concerns is diagnosis of myocarditis, which is inflammation of the heart muscles. So if you had this, it typically requires restraining from physical activity and a period of relative rest for about 3 to 6 months. So I wouldn't recommend exercise for you just yet. If you're cleared for exercise from a medical standpoint, then you fall more into the category of somebody who had COVID-19 but was just sick. And so for this type of person, the consensus varies, but typically still involves some sort of medical workup. Some of the most common procedures seem to be a 12-lead ECG, but again, this is based on the individual and is outside of my scope of practice to determine. Another common procedure is a chest x-ray, which may be needed if you had pneumonia. And for that, usually clearance from a pulmonologist is recommended. After being cleared to resume intense physical activity, a gradual progression should be used with routine monitoring. So for return of any symptoms. So for example, any fatigue that doesn't match the intensity level of the training, a cough, chest pain, palpitations, or dyspnea, which is shortness of breath, that doesn't match the intensity of training, should be reported to your medical provider. One example of a cardiovascular exercise progression from the NSCA, which is the National Strength and Conditioning Association, is a 4-week progression using the 50-30-20-10 rule. And so the way this works is the first week, you're going to reduce training volume by 50%. And that could be training volume, it could be training intensity, it could be heart rate intensity if you're using a heart rate monitor, compared to your normal training. For the second week, you're going to limit your activity by 30%. So you'd be working at relative intensity or heart rate of 70%. For the third week, you're going to use a 20% reduction in activity or heart rate, so that would equate to 80% intensity. And then the last week, week 4 of the progression, you're going to be limiting yourself by 10%. So you'd be working at about 90% heart rate, 90% effort, 90% volume, 90% intensity, whatever variable you're going to use to scale. After the athlete makes it through all 4 weeks without any setbacks, full activity can be resumed safely. This is an example of an exercise progression. It does not the one that you have to use, but I would recommend training with a heart rate monitor during this phase, especially if you had COVID, just in order to monitor the cardiac response, cardiovascular response during training. All right, so the next group of people would be those that had COVID-19 but were asymptomatic. So after the required period of isolation and clearance from your medical provider to return to work and normal daily activities, then a gradual progression of cardiovascular exercise is recommended, similar to what was just previously mentioned. Any new symptoms should be reported, and you should stop intense exercise until you are seen by a medical provider if you have a return of symptoms. One rule of thumb listed in the literature that I thought was worth noting is the idea of a neck check. So if your symptoms originate above the neck, such as sneezing or nasal congestion, that is okay to continue with exercise, with continued monitoring to make sure it doesn't get worse. But anything below the neck, such as cough, fever, shortness of breath, you should refrain from exercising and potentially report that to your medical provider. The last group of people would be the people that did not have COVID-19, but again took time off from the gym, so they're relatively detrained. And those people are not recommended to get medical clearance prior to resuming activity. However, I would still recommend that they follow some sort of a progression. As somebody that helps people exercise daily, I would recommend at least a 2-week period of submaximal activity before ramping things up to full intensity. You don't want to be that guy that burns out during week 1 of your summer shred plan. That's all I've got for today. Good luck getting back into the gym, and let me know what you think about my recommendations in the comments. This was Coach's Corner.